It's Breast Cancer Awareness Month, and I'm Christine Porter with the Times News. I'm with Dr. Roberto Fratamico, an oncologist and hematologist with Lehigh Valley Health Network. We're talking about mammograms and other screenings for cancer.
So when should a woman get her first mammogram? There's been some confusion with that.
Yeah, that's a great question. Sadly, there's no, one sentence easy answer for that. It depends on family history. It depends on a woman's risk, such as if they have a history of BRCA1 mutation, if they've had prior radiation to the chest wall. Those factors all get lumped in order to have us provide the appropriate recommendation. In general, for women that have no concerning family history, no radiation to the chest wall, obviously no knowledge of any mutations that could predispose to cancer, typically women get their initial screening mammogram between the ages of 40 and 50. There are varying recommendations out there, but most women generally start around that time.
All right. How often after they start to get their mammograms should they get a mammogram? Every year, every couple years?
That's another question that I guess can have multiple answers to it. But in short, typically we recommend that women get bilateral mammograms every year. There's some recommendations that say you could go as often as every other year, but again, I think the appropriate range there would be anywhere from every year to every 2 years in those of normal risk once they're starting their screening mammogram.
Is there a point at which a woman doesn't really, I hate to say, doesn't need to get a mammogram, or?
Yeah, that's also a very good question. It depends on their existing comorbidities, their overall frailty. Typically, once a woman gets to be, in their 70s or 80s, the benefit from screening mammogram is less apparent at that point. So around 75, women should be having that conversation with their primary care doctor, their gynecologist, their breast surgeon, whoever it might be prescribing the mammograms. About utility at that age group.
Why should a woman go ahead and get a mammogram now instead of maybe waiting until after a vaccine and things are a little different with the pandemic?
Well, I think with all the proper precautions in place, patients can be rest assured that they can continue to do their normal screening studies and their normal health maintenance during this time as well. So the last thing we want is for someone to sort of postpone these studies and for them to develop an issue that could have been addressed earlier, so that they could have been referred to the appropriate care providers.
What other types of cancers are particular to women that they should get screened for?
So certainly breast cancer via mammography. Just like men, women should start with screening colonoscopies as well. So screening for colon cancer. If someone is hesitant to go forward with a colonoscopy, there are also other options out there that are good to screen for things like, blood in the stool or potentially markers of colorectal cancer in the GI tract that could lead to, a colonoscopy for diagnosis and direct visualization. Because sometimes we just can't get a good understanding from the outside. We really have to take a look from the inside. Cervical cancer screening is also very important for women via their gynecologists. And those three are really the main ones that women should be screened for.
What is the most common type of cancer for women?
So breast and lung cancer are both very common in women. There's a frequent misconception that, women don't get lung cancer, but that's certainly there are less women that have lung cancer than men, but it's still a problem in women. And, I should say that going back to your prior question, it's also a cancer that could be screened for in women as well if they have a significant smoking history, or if they're of a certain age, or have quit smoking within a certain interval of time. They could certainly get a low-dose CAT scan of the chest to screen for any concerning lung issues that may have resulted as a result of smoking, or just spontaneously developed. The front and center issue at this point is, should I get this done? Should I do this, that, and the other thing because of COVID, especially with cases rising? Time will tell, but we've been through the first surge already, so the hospitals are prepared and they've developed protocols in place to make sure that patients are still safe while they get the care they need. So I would advise patients to keep up communication with your care team so that things don't lapse, and we can still screen and provide great care even during some challenging times.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.